The mornings have just started, and it's gonna be, I'm assuming and hoping it's gonna be a beautiful day filled with a lot of learnings over here. Now we have a session on skilling and human resource mobility to aid health service delivery over here in this seminar. And I would like to now invite over here our session chair, Mr. Atul Kumar Tiwari, Secretary, Ministry of Skill Development and Entrepreneurship. While he's walking, can we please have a huge round of applause? Welcome, sir. I would now request and invite our moderator, Mr. Kiran Vaska, Director, National Health Authority, Government of India. Moving ahead, I would like to invite our panelists on stage. We have with us Mr. Ajay Kumar Raina, Group General Counsel, NSDC, and Director and COO, NSDC International. I welcome and invite Dr. Bishnu Panigrahi, Group Head, Medical Strategy and Operation Group, Fortis Healthcare Limited. Joining them on stage, we have Dr. Abhishek Singh, Joint Secretary, Dental Council of India. We have Mr. Jayboy Thomas, CSMO, Marengo Asia Healthcare Private Limited. The panel discussion will shed light on the challenges, opportunities, and numerous possibilities in the skilling and development of health workforce over here. Thank you.
Thank you very much. With the permission of the chair, we'd like to start the proceedings of the day. So, yesterday, we've had a very fruitful day in which the Honorable Minister and the entire whole government, we have launched two main portals. One promoting patient mobility or the medical value tourism, the other to enhance healthcare workforce mobility with an objective to ensure that the idea of integrated healthcare or try to bring about a continuum of care not only in India but also worldwide with the objective of One Earth, One Health that is being promoted as an idea under the G20 presidency of India. So today we would like to have the discussion on how we can make sure that the workforce that is being produced in India, how we can enhance their quality, and then make sure that the international mobility of this workforce is streamlined, it is made more smoother, and then it also meets the requirements of other countries as to what kind of skills they would have to possess in order to go and start practicing them, what kind of strategic partnerships we need to have. And at the same time, we'll also talk about how technology is to be leveraged to make sure that this movement and this transformation is seamless. And with experts with us, we would go ahead and also talk about what kind of regulatory simplification or structuring is required. The expected outcomes of this panel discussion would be to understand better the idea of enhancing workforce competencies, optimizing the whole service delivery structure, how we can do cross-sector collaboration in a better way, and what kind of policy recommendations can come out of this discussion. So we have with us Secretary, Ministry of Skill Development and Entrepreneurship, Shri Atul Kumar Tiwari. Sir, I would request you to kindly provide your opening remarks and guidance on how we can take this agenda ahead.
Good afternoon to all of you, now from morning to afternoon. The moderator, Sri Kiran Vaska ji, Mr. Vishnu Panigrahi ji, Abhishek Singh ji, and all the delegates and international representatives here. Probably this is the wrong time to start. It is in the cusp of the breakfast and lunch. And maybe there are too many sessions going. And certainly I will not take it as a kind of a slide to the, when we talk about the skilling, because as you know, healthcare is one of the largest service sector industries, and it is also the second in terms of employment provider. And Indian healthcare market itself is estimated to, which was around $110 billion in 2016, is going to reach almost $460 billion by 2025, and maybe a CAGR of almost 16%. So the way the population is increasing in India and the demographic change in the world, where certain parts are aging and certain parts are growing, it is necessary that we augment both the volume and skills of the healthcare workers at all levels of this sector, so that we ensure a quality delivery of quality services and also provide improved healthcare services to all. And there is a gap which I am told that it may be around 18 million shortage is going to be there in 2030, and it is at all levels, from the doctor, nurses, technicians, health professionals, and skilled health assistants. So this session on the skilling and human resource mobility to help improve health service delivery is very key element of all that we talk about the healthcare in India as well as in the world. The government of India, as you all know, has taken many transformative steps. We have increased the number of doctors and nurses, allied healthcare. Some education standards of healthcare professionals have been finalized. The model curriculums have been developed. Professions like optometrists and others, they are also getting due attention there. And how we also improve the quality and delivery of technicians in labs, that also has taken a lot of importance. There has also on legislative front also the National Medical Commission Act is there, National Commission for Allied Healthcare Providers is there. So on the policy front, there are a lot of things which has happened in India which will help improve the healthcare providers, their presence, and also in turn improve the health service delivery. As regards the skilling, I would like to say that we have almost 46 qualifications are there, which are for the short-term training, and they belong to the areas of caregiver, which are the aged care, patient care, hospital care, home care, emergency services, diagnostic services, healthcare management, and other healthcare services, Ayush for that example. We have under that long-term training called the Director General of Training, so we also have 6 trades. And during the COVID, Kiran, we also did was that we brought out one customized COVID frontline care worker program in 6 disciplines. And we managed to certify almost 1 lakh COVID care workers in 6 COVID courses. We also have around 500,000 trained and provided to healthcare sectors by various healthcare roles, including caregiving. We have a very well structured skilling ecosystem, helped by the Healthcare Sector Skill Council in the ministry. We have a tie-up with the hospitals, healthcare providers for on-the-job training and internships. We have a large pool of trainers and assessors, certified trainers, almost 4,500 and 1,200 certified assessors for training and assessments of candidates in various qualifications across India. We have hospitals, healthcare institutions, hospices there which are involved in training. And healthcare training is also being done in collaboration with universities and colleges which are affiliated with UGC and AICTE. There are many government schemes as well, like the scheme done by jointly by the Ministry of Health and Social Justice about the PM Specialist Scheme for in the area of aged care and elderly care, geriatric caregiver. We have Ayushman Bharat, which is a PM JOI, which is working closely with National Health Authority for training. PM Arogya Mitras, around 10,000 have been trained and certified till date. We have national medical device policies there. We also have the special focus on medical value travel is also there. And for international mobility, we have done a lot of work under the ministry with the National Skill Development International, to which my friend Ajay will speak more on detail about that, whether it is sending healthcare workers to Japan or Germany or Middle East or United Kingdom, Israel, Australia and others, that also we are working with them and in terms of identified job roles. So today I think the discussion would normally consist of the point which has been listed by moderator Kiran. Actually, the idea is that if we want to increase the mobility of the healthcare workers, first of all, we need to define what is exactly we mean by healthcare, so that it is not in a very tight-fisted manner in which the healthcare delivery has happened. I worked earlier as Principal Secretary Health in Government of Karnataka, so I know how short of doctors and nurses and healthcare professionals we are in the rural areas. So the solution is that we need to develop, as Dr. Devi Shetty has been saying, the number of the such professionals. At the same time, we also have to provide career pathways for them. And as Dr. Shetty has been writing in the newspapers, that the day when a nurse or healthcare workers, by acquiring skills on the way, becomes a doctor, that is when we have arrived and added value to the whole skilling and healthcare ecosystem. There is also a requirement that we need to see how we can send people when we have shortages in India also to abroad, and the demographic profile that our country has, maybe we can develop the healthcare professionals in such a manner that they learn, earn and return kind of paradigm can also be there. So that, and for that it requires a collaboration between the countries so that the qualifications are finalized and there is some equivalences arrived at. Maybe there is also requirement of some new healthcare job roles also requires to be done. And of course, the cross-border mobility also requires certain liberal view of movement of these people so that they can go out with the adequate qualifications which is required in the destination country for circular migration. There is also a need, as I was telling Kiran, that there is a need for us to see that the pool of such healthcare workers is also enlarged, provided there is no let-up on the certification and their qualification, their certification, assessment, etc. And probably it is one area where there is an immense amount of collaboration is required, not only between the government of this country and the corporates and the hospitals and skilling and medical education institutions, but also among the countries, so that conjointly together we address this problem of demographic change with adequate supply of healthcare workers and their mobility so that we can meet the challenge which we have. And there is a need for, I would say that we have to go out of our comfort areas. As I was told that there is a health workforce mobility link is there. I would like to say here that in the skilling side, we have the Health Skill India Digital, which is a portal which is designed for skilling and various other matters related to that. So if that can be linked, then we can also get to know what are the skilling requirements, where is the demand, and what kind of skills are required, so that our system, a skilling ecosystem, healthcare sector skill councils, and our associate hospitals and colleges, we can work on that. And I would say that the key of the moment is that we need to have a system whereby it becomes inevitable that the healthcare professionals, they are able and allowed to update their knowledge, their competitiveness, working with technology, etc. And the only way such big transformative changes can happen when we work together as a one entity and learn from each other's successes and challenges, learn from our best practices, and collectively contribute to the growth and delivery of the healthcare services in our country and in the world. I'm very keenly look forward to the question and answer session, and also the suggestions from the audience, if any, so that if there are any inputs which can further help us improve the skilling endeavor that we have undertaken in the healthcare sector, that will be very, very useful. So thank you very much, Kiran.
Thank you, sir. Thank you for your opening remarks and your guidance, sir. Sir, we have representation from the Skill Development Corporation, from professional regulators, and also the industry. So we would have a round of questions with them, and followed by that, we will have questions from the audience, sir. So, sir, I would like to start with Mr. Ajay Kumar Raina, Group General Counsel, NSDC, and Director and COO of NSDC International. Sir, one of the chief issues of the workforce is that there are shortages not only at the regional level, but also in terms of different specialities. So could you please throw us light on how the corporation or the government is actually trying to identify different ways of skilling and training so that we are able to address these shortages?
So I will elaborate upon the international thing, so yeah, how we are working on it. So basically we are trying to do the skill harmonization of the qualifications between the respective countries where the demand is more. So we are using the technology also. So there is a other aspect where we are working on the clearing the language barriers. So most of the countries, the visa requirement, language is one of the visa requirement. Like in Germany, unless until you are having a B1, you can't get the visa there. Similarly, in UK, for a nurse you have to be IELTS 7, or for a caregiver you have to be IELTS 5. So these are some barriers which the NSDC is working upon. So we have we have done the collaboration with the various institutes which are providing these language trainings, like Gothe is from Germany, then OIT is from Australia. So we are working with those partners. Then the clinical training is one of the crucial aspect where our health workforce, when they land in the country, so they have destination country, so they have to qualify that clinical training first so that they can get the job, like OSCE and NCLEX. So we are having it's still not a discussion, so we are having a discussion with them so that trainings can be happen in back in our country. So that's all which we are doing as of now.
Thank you so much. We have Dr. Bishnu Panigrahi with us, representing industry. He is the Group Head of Medical Strategy and Operations for Fortis Healthcare Limited. So, industry is an important partner in trying to fill this gap, and it is only with effective partnership between public and private enterprise that will be able to address this. Can you please shed some light on how you think industry can contribute in building a robust healthcare system at the same time, and while ensuring that workforce training and skilling and mobility is also ensured, and what is being done from the private sector? If you could please shed some light on that.
Thank you. Good afternoon, everyone. And I would like to thank the Ministry of Health and FICCI for organizing this. And I think so we are at a very important inflection point India is concerned. We are now entered Amrit Kal, and as the Prime Minister also mentioned, it is the youth and the women workforce which will take us forward. So keeping that in mind, I think so, as I remember when I in the medical college, our teachers used to always tell us, the eye sees what the mind knows. So we have to be very cognizant of this. And how do we keep our workforce healthy? We keep talking about demographic dividend. The Nandan Nilekani book is an excellent book to read. But it's just, if you just read the book and it's just talk the talk. But now the time has come to walk the talk, in the sense that how do we keep our young workforce healthy? So keeping that in mind, our capacity expansion has to be there. We have to expand, and there's no better example than the Black Swan event happened, which a couple of years back, the COVID, and it was a seamless integration and partnership of the public and private sector. I think so the public sector stepped up, and I guess most people, because I was part of the 2 years I was in Bhubaneswar heading the KIMS thing, where the public-private partnership happened. With the government of Orissa, we set up 1,050 beds, 500 in Bhubaneswar, and in 3 district headquarters hospitals, private with ICU beds. And it was a seamless, and this happened across the country. So I think so. And that was where to be honest, being after leaving my teaching job, 30 years I've been in the corporate world, there was a trust deficit. There's no doubt. But I think so the pandemic mitigated to a significant extent, and I think so we have to now forget the past and go forward. So how do we enhance our skills? And see, everyone cannot become a doctor or nurse, but there's a lot of workforce which helps the whole ecosystem, healthcare ecosystem function and work like a well-oiled machine. So whether it is the technicians there, the perfusionists there, everyone who walks into the hospital, how do we, so first of all, what I say is that we have a lot of friends from outside India also. Look at, there's not one hat fits all. That's not the way that we should be looking at it. Look at your place that you work in, your hospital, your district, your county, or whatever it is, and look at what are the gaps that are there. Identify that gaps. Identify what are the services that you provide, the medical services. And if the gaps are there, how do you look at, do we have the wherewithal to enhance the skill sets there? If you don't have it, then you must look out where you can do it. So again, coming to your point is that this is where I think so the private sector will play a big role, is that across the country, I'm not speaking on behalf of Fortis, I'm speaking as a member of the Health Services Committee of FICCI, is that the corporate healthcare is there to pick up and help out. A lot of things have come in, which Tiwari was mentioning. A lot of programs have come in of enhancing skill sets of the nurses, of technicians, radiology technicians, ultrasound technicians. So these things have to be in play. Even a small phlebotomist who takes out the blood from the patient is very important, because that is the first. Imagine someone going and collecting blood from your wife or your daughter. There's panic there. But if it is a nice way of doing it, and it's not painless, but as far as pain-free as possible, it's a huge upside that is there. So all these things have to be taken care of. So this is what I want to say is that. And the other good thing is that if you start enhancing your skill sets based on the different touch points in your hospital, whether it is the emergency services are very important. There are the critical care services, the OT. So have a look at those areas. Do you have the manpower? If you have it, dialysis, diabetic care. The NCD is, we are now, unfortunately, we call the diabetic capital of the world. But there is a huge gap in the way we manage our diabetic patients. There's a huge gap. And this is where you don't have to always have a doctor to do everything. If you have a nurse or a healthcare worker who can be looked at, what are the things you should be communicating with the patient of the blood sugar levels, what medicine is taken, at regular intervals, certain tests have to be done, because diabetic also has its after effects on the kidneys, on the eyes. So if these things are done, we know that it'll be hypertension. A stroke is a very important part of our daily lives. All of us, and our friends, families, someone who had a heart attack or a stroke. Again, are we treating our patients, family members, friends, relatives who have a high blood pressure, treating properly? Because as I say, a well-treated hypertensive behaves like a normotensive. It's a very important message. So have the skill sets, enhance them, and this is where the private sector will come in, and the critical care nurses training has started happening in many of the healthcare chains. Dialysis technicians, X-ray technicians, ultrasound, and another thing which I would like to put on the table is we always forget about mental health. Mental health is a very important aspect. We in India, I don't know how it is abroad, but in India, it is still considered stigma if someone in your family or someone has some mental issues. There's a stigma attached to it. I think so. We have to come out of it. We have to be more open. And again, the mental health setup is not only the psychologists, psychiatrists, but there are counselors there. How do we get them? This is where telemedicine comes into big play. What I'm trying to tell is that, and that's from example I'm saying, we without taking names, a patient from Ranchi. Now, if he or she has to come with his family, say to Delhi or to Mumbai or Chennai, imagine the cost that the family has to pay. But in teleconsult, a lot of things can be done. So I think so. This is how we have to leverage technology. We have to enhance our skill sets, and the most important thing is that in the healthcare sector, more than 50% of the workforce are females. And and here also I see 50% are females. So if the female workforce is properly employed, gainfully employed, it has a huge societal upliftment. A woman who takes in that paycheck, they use it properly for good food, for the children's education. So there's a society upside there. So I think so. This is another message I would like to say is that healthcare is not only we look at it as providing health. How do you keep the entire social ecosystem in place?
Thank you so much for your insightful comments. In fact, I mean, your observation on mental health is really, really important, and use of teleconsultation for mental health is something that I think can not only reduce cost but also enhance anonymity, because one of the stigma is going there to a mental hospital. That itself is a big stigma, and in fact, if I am able to receive that counseling by staying in my home, I think that itself helps a lot. Right. Thank you so much. So we also have Mr. Abhishek Singh, Joint Secretary, Dental Council of India, and the various professional councils in our country play a very, very important role. In ensuring, in regulating and the practices of these professionals, and in certifying them, and in also ensuring that they are provided with the required skills from time to time. And enhancing or increasing this skill base can be done with only when the councils take the lead, and they do what is necessary to take it forward. So since you are from the Down Dental Council, I would first like to understand how we can leverage India's dental health workforce for achieving this better health outcomes, not only for our country but also for outside, and what kind of work is being done by the Dental Council to get this task done.
Thank you, sir. Thank you for the question. Before answering this question, I would like to tell the objective about the Dental Council of India. The first thing is that the objective or the core of the Dental Council of India is emphasize on the teaching and training and treatment of the patients. And for that, Dental Council of India believes to enhance the skill of the students in the institutions. So regarding that, laudable steps has been taken. If we talk about the policies in numbers, from 1948 to 2003, there has been 27 amendments has been done in our act regarding enhancement, regarding everything which comes in the purview of the Dental Council of India. Recently, what we are doing is that we are upgrading our curriculum in a more global level. We have surveyed 85 institutions all over the world. We surveyed them. We surveyed their curriculum regarding the timings. Like in India, we have 4 years of BDS curriculum. We have surveyed 84 institutions all over the world, where we found that most of the countries like USA, Europe, Australia, these are having 5 years to 6 years curriculum timing. But we found that in that curriculum, 5 to 6 year was the most popular. So we opted 4.5 years of timing of the curriculum. Second, we made the curriculum more scalable. Like right now, in our present curriculum, there is no probability of scaling a new skills. Like suppose if I talk in terms of the dental, we are still teaching our students for silver fillings. But nowadays, there are numerous recent advances has been done. So we are adopting that scalability in our curriculum to enhance the skills. Also, if we're talking about our technologies, previously we are mandating the incorporation of 3D maneuvers, we are lasers and newer technological advancement in our curriculum. So also we are promoting the comprehensive clinic setup, which was not earlier present in our curriculum. So we are making that thing mandatory. So by these steps, we are making our students more scalable. If we talk about how they are going to serve outside the country as well as rural remote areas in our countries, as we know that our dentist to population ratio right now is 1:4,685. According to the WHO, the ideal the ratio would be 1:7,500. So that means we are already surplus dentists present in India. But the challenge is that they are densely located to the urban areas only. They are not in the rural areas. So we propose the ministry to make to send them to remote areas or to send them to peripheries. We propose a family practitioner curriculum or family practitioner thing, in which we are we telling them to that will promote you to go there and serve the rural areas by giving chances to like making satellite clinics and making satellite clinics mandatory to the dental colleges.
Thank you. And I think it's in fact heartening to hear that at least on the dentist side we are in a surplus, and I think we can actually now look outside the country to satisfy the needs of other countries also through our workforce. My next question is to Dr. Panigrahi. And you spoke extensively about how public and private sector need to collaborate, and that deficit of trust was to some extent bridged thanks to the positive side effects of the pandemic. Do you also see any restrictions or any barriers in increasing the number of trainees in the private sector? In the sense, at the end of the day, I need to get trained in a working hospital or a working entity. So there has to be so many number of vacancies that need to be created. Do you see any barriers there? Do you see any support or any kind of changes that you require to be made by the government or otherwise?
In fact, you just hit the nail on the head. In fact, last week, Nat Health also is working on this. It has come from Niti Aayog. Dr. V.K. Paul has been pushing that the private sector should double the DNB seats. It's just double. That's the mandate. This is it's equivalent to MDMS, so national board, and now it comes under NNC also. There were certain drawbacks there about because you have to have it has to be more than so many beds, then only it will be accredited for DNB. You should have so many faculty members. So those things. So now they are working on it. They've already rolled out a few things. Is that they're looking at having it as a cluster. So unnecessarily, for example, a hospital maybe just 100 beds, 125 beds, but they're very good in say renal care. Now, if we have those skill sets, can't we have a DNB course there for training the doctors there, training the dialysis technicians there? But that is not accepted. But now, thanks to Dr. Paul's intervention and DNB coming in, they have said that if in a cluster of, suppose in Delhi NCR or Mumbai or in Bangalore, we have multiple hospitals, we can club them and start the DNB program. It's not necessary that, so this is what has happened. Then per teacher also they've increased the number of students you can take. So then there was a minimum teaching experience that was there. If you're not a recognized teacher, you cannot apply for DNB. I recollect my early days when I was in the Rasta Polo. When we started, there were only 3 of us which had teaching experience. So based on us, we could get it. There were a lot of departments which had very good doctors, could not start DNB because they didn't have teaching experience. So some of the barriers that you're talking about, those things are now coming down. And the other thing is that they are looking at, because once you pay a stipend to the students, to the technicians who are coming for OT training, for dialysis training. So the government is also looking at, that talks around to give some sort of a financial subsidy. Again, it is not yet done. I'm just, I should not be quoted in that. But I think the talk has happened. So it's a two-way affair. It's happening. So it's in a very good way of mutual trust. So I think we have to step up, as you rightly said. Unless we have more doctors, more nurses, more technicians, how are we going to serve the people? The demand is increasing, and now we're talking about medical valley travel. We expect more patients to come from outside. So we have an inherent Indian demand. So to coping them up is a challenge. Now to take the enhanced demand from outside, we have to have the capacity in medical infrastructure as well as manpower capabilities. So these are 2 things that we are looking at. I think so the discussions are on. Hopefully we should be coming to a good conclusion.
Thank you so much. In fact, I was participating in one such discussion, and yes, there are these steps being taken to increase the number of seats in the private sector. Now, yeah, of course. I have one question for you, sir. Sir, from the government level, sir, if you can please shed some light on how government policies and regulations influence skilling and mobility, sir, and what the government is planning in terms of making it much more simpler for people to move out, or what kind of collaborations are we planning to have with other countries and other stakeholders to enhance this mobility across geographies, sir?
Thank you, Kiran, for asking this question. In fact, as the panelists have pointed, we need to step up. And step up not only in the number, but also in the terms of quality. And if I can say from my limited perspective of skilling side, I think there is a need for us to, what shall I say, for want of a better word, I will say that while we need a more liberal regimes, we also need to strengthen our quality regulations as well. And one problem which we had about this skilling was, I was telling Kiran just now, that the Allied Healthcare Act which is there, it needs to be panned out in such a manner that it allows the different stakeholders also to come in for skilling and providing the medical or healthcare professionals into the hospitals. And just depending upon the hospitals and the colleges, to what extent, considering the demand, we need to rope in other stakeholders as well. And I would say that insofar as skilling is concerned, like the COVID care, which we did in 6 months, 1 lakh allied healthcare, the healthcare workers, phlebotomists, emergency health assistant, HDA, and that kind of a thing. So when we started rolling it out, then we realized that just depending on our skilling centers was not going to enough. And we had a talk with the IMA, we had a talk with the different hospital groups. And many hospitals were also turned into the skilling centers. So the point what Mr. Panigre has been saying, that the hospitals needs to improve and I say embed the skilling centers as part of their whole repertoire of the activities. And many times we found that the chief nurse would be able to give a very good training and very authentic training as well. So that is one part which the private sector can come forward in terms of providing their facilities for skilling, not only for themselves, but also for supply for outside. And some incentive mechanism can be worked out by the regulation as well as while taking care of the quality and the number itself. Maybe the Medical Council of India or Allied Healthcare Council or Health Ministry per se, they can look into this, and what Dr. Paul has been suggesting is a very right way of going ahead on that. Second thing, we have found out that many times the quality of the, say for example, the nurses, etc., who come from the nursing college, etc., is deficient. And how do we know it? When we try to send the nurses abroad, then as Ajay Raina ji was saying, yes, they have a problem with the languages, so we can fix the language by occupational English. We have a whole bunch of females from Northeast whom the NSDC International is training on a Japanese language in Gurgaon. And I request you to also come and see. Similarly, he's doing about the German. Similarly, he's doing with the English. And a lot of English, such courses also we are trying to integrate. But insofar as the nursing skills are required, there is also a need for some kind of a gap filling. And that is where whether it is the Nursing Council or Dental Council or the MCI, whatever, they also need to look into that part and can design some kind of things which can be taught in a different combinations, so their skill level matches, so that is allowed for the certification which is of international standards. And the regulations are important, but regulations should not be too constrictive as well. And there is always a way to redesign our processes in such a manner that without compromising on quality, we can also increase the number. And that is the area where we need to work.
So can I come? So very nicely said. One request that I have is that we are too metro-centric. So I think so to upskill the health workforce, we have to go to tier 2 or 3 cities. And because I'm just giving an example, everyone can't come to a Delhi or Mumbai or Chennai because there's a cost to it. Sending the young boys and girls, there's always a barrier. So if they are, if it's in Bharat, if I can call it, there'll be more likelihood of the parents sending them there. So I think that's one thing that we should look at. And I think so, you put something in my head which we'll take back and work on, sir, is that for everything, you mentioned about nurses, for example, a nurse working in, say, in the critical care, what are the basic things that they should have? Like, we do it, but at least a basic, if it's an objective way of looking at some things that they need to have, some sensitizing training, they do that and then they go and handle the patient. It's not the nurse, then you send him to that ICU. Similarly, someone going to the OT, someone to the dialysis, to the cancer is increasing, daycare chemo is increasing. So I think some standard sets we need to build. So I think so from the on behalf of the health services sector, from FICCI, I'll try to work on my teams and for different groups. I'm talking about the paramedical and nurses because it's something that if you do it, it will be a huge game changer and that we roll it out. So suppose, I'm just saying, suppose in say a small town in Orissa or Karnataka, so there's a hospital and it's a decent sized hospital. We can have the training programs of upskilling there, but we have to follow this. And we can have trainers come in from, I think it will be more economical and it will be more doable to do it at their base level than asking them to come to Bangalore or to Chennai or
Please, sir.
One way of improving the healthcare service delivery is that our reliance on the doctors and the specialist degrees, they get more and more confined to the big hospital like yours or specialized hospitals in the urban areas, is to develop the second rung of the healthcare, which is the non-medical healthcare. As you said, our dialysis technician, phlebotomist, such a difficult word to pronounce, phlebotomist. So that is so important, you know. Now, if you go to each hospital, they will say no, they would like to take their blood sample themselves, rather than depending upon Dr. Lal or some other path lab. Similarly, so these are the areas, as you very rightly pointed out, Mr. Panigri. You're doctor, no? Your name doesn't mention doctor. Okay. Dr. Panigri, so what I would say that these areas, we, as you very rightly said, we find the gap. And then work on that so that they are most of the time the patient is taken care of by these people, like the HDA person, like the nursing assistants, like the people who do not require 3 years, 4 years of medical specialized courses. But at the same time, they create so much, contribute so much to decrease the load of the doctors and nurses. In fact, the basic idea of our doing the COVID care, 1 lakh people, COVID care specialists, customized COVID care, we had a healthcare sector skill council chair by Dr. Devi Shetty and other doctors. We found out that this course needs to be customized. We reduced the formal portion to 3 weeks, added 3 months of internship in a government and private hospitals, during which time we also gave them a stipend. So that after the basic training, they are immediately able to go towards the healthcare delivery system so that they can reduce the load of the doctors and nurses, at the same time take care of that. And this model, why I'm suggesting is that when we started to pan it out, then we talked to Fortis Hospital as well. And there was a lady there, and we found out that they were able to provide so many persons skilling at their hospitals. So many hospitals came forward. So this is a shining example, as I would say, that as you said, I think epidemics forced us to first think on our feet, collaborate without any boundaries between government and private, and customize for the needs. So this is a time for us to leave behind the straight-jacketed things, customize things as per requirement, while keeping the essentials, which is the quality and in check, and increase the number. It requires quite a sea change from the, I would say, I've worked in health sector. It's very difficult for the doctors even to accept the Ayush doctors, for example, which we employ them in a large number in the rural hospitals for the delivery and other such systems. So unless until we also modify the healthcare professionals, a question which was asked by Kiran, in a way that we see the need, customize, improvise, at the same time have a good system where the assessment and skilling certification is made pakka by use of technology. That is the only way we can move forward to meet the huge mammoth demand of the healthcare professionals.
Thank you, sir. My last question is to Mr. Reina. And in fact, I'm just improvising this question mainly on account of the kind of participation we have seen in these sessions, where we have a lot of representatives coming from Africa, mainly from the Francophone region. While we have very strong ties of movement of people with the English-speaking region, but our concentration on Francophone countries has not been that much. So, as Director and CEO of NSDC International, can you please shed some light on, are we doing any special efforts to address, reach out to these nations, or are there any such plans, so that there is a huge demand and there is a huge shortage there also? And if there are any efforts, or if there is any direction that thought in that direction, please.
So as of now, yeah, Africa we have not started, so we are still studying it. So on the ground it has not been started. So for the rest of the, where the demand is still there, a huge number like Australia, Germany, Japan. So we have started there, we have started the courses there. Now thing is that, so what we are doing there, so basically now for the Japan, as sir has rightly said, so we have introduced our Japanese language course back in India, so where that all the healthcare workers are giving the Japanese language training. So they get trained here and then they are placed on the respective jobs in the Japan. So with respect to bringing the best practices from those countries, so we are also discussing with them. So these best practices are then implemented here with our all the candidates who are getting training with us. So we are also trying to do the exchange program. So where the healthcare workers will go to the different countries, learn the technology there, come back here and give the trainings to other people. So there's like a training of trainers. So this is the thing which we are still working on. Yeah.
Thank you so much. Sir, with that, shall we open up questions for the participants? We have I'm sorry? Uh-huh. Ah. Yeah, so now the floor is open and you may kindly ask any questions or clarifications that you may have.
Thank you so much,
that will be
Mr.
useful.
Moderator,
Yeah.
and I thank you so much. The problem is that we have not been hearing very well. The conversation has been literally between the people who have been sitting in front, even the body language. So it's going to be hard for us to ask you questions because we're not really following well because the conversation was not very audible to us, especially in the audience. Thank you so much.
So you can actually pick up from wherever you may not have understood and say if there is any question, specific question you have, I think we'll be happy to answer. I apologize that maybe the conversation wasn't loud enough for you all to hear. I hope I am audible to everyone in the hall right now, right? So you have any question or anything specific that you would like to know about?
Thank you so much, Mr. Moderator, once again, and I thank you so much for giving me this opportunity. A bit of a question is to Dr. Atwell. You've talked about skilling, particularly for us people who are coming from Africa. You're not giving us enough scholarship. You're not actually they're giving us scholarships in many fields, but we're not getting scholarships in medical and also internship. So when you talk about skilling, going to other countries, what about us, the Africans, who are most vulnerable right now? Why I think we're not benefiting a lot from One Earth and One Health. Thank you.
Are you having any internships and scholarships for people who are coming from Africa? And are we planning to provide them an internship for skilling or funding for them?
Mr. Moderator, can I just supplement?
Yes,
Thank
please.
you. Thank you, Dr. Kiran, for moderating. I am Professor Joyce Chikafunda. I am the High Commissioner of Uganda to India. This is one of my staff. So our question is related. And my question is to Dr. Tiwari, I believe representing government. Because I have been 1 year in India, and when I came, I was informed that the government gives us scholarships, I believe, to other African countries, but let me concentrate on my own country, Uganda. And the scholarships they give, medicine is excluded. So I wondered why, when India is among the top countries in the world for medical training, and they are trying to spread the knowledge to Africa as they are our supporters, how can that be addressed? Is it a policy? Is it cast in stone? Can it be changed? Because it really bothers us, because medical training is very expensive, and even if you allow 1 or 2 per year, but excluding it completely, is what bothers us. Thank you.
Sir, I think like this is beyond the purview of this current discussion.
Madam High Commissioner, thank you for your question. I will keep it closer. Sometimes my voice is too loud that you will be able to hear it properly. So the issue here is that the first is the India versus say Uganda or African countries. Our country has a very special corner for African countries. Just 1 and 2 months back, we had a big conference in Delhi where many African nations had come forward, and our Honorable Minister for External Affairs had laid down the whole way that we would like to collaborate and cooperate with the African countries. Now the Government of India has decided to open ITIs, IITs, say we are opening in college in Zanzibar, and we had sent our people to Tanzania and also to understand what can be done there. The best thing for a country like Uganda, we have been through that, ma'am. Now that we have some bit of advantage, but we are also basically developing countries like yours. The best way to do is to establish such kind of institutions in your own country, and maybe take the advantage of whatever the pathway, the framework which is developed by Ministry of External Affairs to put your request there, so that we have similar institutions like AIIMS in New Delhi. There's also there in Uganda, for example, where our people can go, set up this office, hospital, train your people. Initially, they can come here and train it. This can happen in the ambit of the bilateral cooperation between the two countries. Since I am not from Health Ministry, I will not be able to tell what is the government's view on these kind of things, but I am suggesting in a general way that this is the process which can be followed, because putting all of your country people to India, however we give our stipend, etc., it will be very expensive. So the best way is to develop the capability in the environment itself, and that some kind of cooperation can certainly take place. Or you can also liaise with the Kiran here. He will help you work with the Ministry of Health in terms of what are the different schemes and legislations which we have, which can bring certain amount of structure and institutions in your country.
Can I just supplement this? Because a lot of my friends, to his point, went from All India Institute of Medical Sciences in New Delhi, set up a hospital in Afghanistan, in Kabul, and it was functioning very well. That a team went from All India Institute of Medicine, went to Oman, set up a cancer hospital. So, what Mr. Tiwari is telling is that if you will identify that and get back, it is possible. Because it's not that we are talking theory, it has been done by All India Institute of Medical Sciences with the support of the Government of India.
In fact, I was speaking to one entrepreneur from Chad who had been living in, Congo, who had moved to Congo 17 years back. He is currently running a hospital, and he is not only training the local doctors there, but he is also taking doctors from India to there to run that. So this collaboration is there, but I think training, yes, you are most welcome to come and train in India, and government is providing all the support. But establishing institutions like Sir has mentioned is something that in fact, our IITs were also initially started with collaboration with developed countries at one point in time. Today, they are as good as any other international institute today. Are there any other questions we would like to? Yes, please.
Good afternoon, everyone. My name is Dr. Krishnan Moose from Vaidyaratnam Group.
If you can speak a little louder now, it's the other way around.
Sorry. So myself, Dr. Krishnan Moose from Vaidyaratnam Group. I represent the Ayush sector. So there are two submissions I would like to put forward. So one is regarding the education policies in Ayurveda. So when you look into the global platforms, there are a lot of people representing Ayurveda segment in the global platforms. And when you look at the number of people who have undergone the proper educational practices of India, that will be very less. So there are people coming with to India to learn Ayurveda, and they are learning for 1 month or 2 months, and they're trying to practice abroad. So when we're dealing in the illness segment, and when we treat patients, they interact with us and they tell us like we have been exposed to Ayurveda in a different way. And at the same time, we have graduates learning Ayurveda from National Institute of Ayurveda and similar National Institute for 5.5 years. So there should be a policy norms of learning Ayurveda from India, and likewise, when graduates learn medicine from abroad and they have some standards, they undergo some education policies of India to write exams. Similarly, if someone want to practice Ayurveda systems abroad, Indian government can put some norms so that the standardized protocols will be there. And that's one of the submission I have to make. And second one, recently we had a group of students from Malaysia who wanted to learn about the drug delivery systems and molecules in Ayurveda. So there is a scope of drug development, and regarding the drug delivery systems of Ayurveda, regarding the pharmaceutical side, that can be put forward to the global scenarios. Unless that has been shared with the global scenario, the system will not be fully accepted by the world. So if that part can be shared as a student exchange programs, likewise we have IITs abroad from the central government. Likewise, if you can share the knowledge, that will be a great impact, really positive impact to the Irish systems. That's all. Thank you.
Thanks. Can I answer that question? Thank you for that question. And in fact, the portal that we launched yesterday, the Healthcare Workforce Mobility Portal. So the whole objective of the portal is to create that single source of truth for professionals that are trained in our country, be it Indian or foreign. And they get accredited or recognized by agent or regulatory bodies which are recognized by the government. So that if I say that I am an Ayurveda practitioner, if I say that I'm a yoga teacher, that is verified by somebody who is authorized to do that. And only those entities who are verified will be allowed to participate in that portal, then eventually go out and practice. So, and this is already being done for the Medical Commission, the Dental Council, Nursing Council, etc. Ayush, in fact, is one of the active participants. So the sooner the curriculums are standardized, certifications are standardized, and they are verified digitally, the sooner we will be able to prepare professionals to get these certifications, and then they are ready to go out. So that there is no lack in skills for the people who are going outside. That is one. Another part is about the drug dispensing, the drug delivery system, etc. The drug registry that the Ayushman Bharat Digital Mission has created is open for drugs from the Ayush sector also. I think that is the first place where we start registering these drugs, so that first of all we have a registry or a verified entity or list of all drugs, and then that information can be utilized by other systems. And this becomes again that knowledge base, it could be shared, and it is a digital database. So I think by utilizing these two initiatives of the Digital Health Mission, this issue of standardization, skilling, and spreading the knowledge can be addressed to begin with. So I think that answers your question. Yeah, there was one more person from that side. Yes, please. I think we'll have the last two questions for the session.
Thank you. Thank you for the lovely session. My name is Karen. I'm from a startup called Here Natal. So we work on audiology sector, which is under the Allied Health Sciences. So how do we see right now we are developing a little bit of softwares in order for healthcare sectors, especially in audiology, since there is only one audiologist in 20 lakh population in India. So we are trying to mitigate it by developing a lot of softwares for community-based screenings and everything, so the audiologists can focus on the clinical sector more than managing the administration at the same time. So right now we are setting our steps into the skill development training, specifically in the field of audiology. So I wanted to see how Skills India can actually, where you can see a startup such as ourselves, we are working in a very niche area in the allied health sphere.
Would you like to take that?
Yeah, please get in touch with us. We'll talk more on bilateral basis.
Sure. Thank you, sir. Thank you.
Yeah, one last question at the end.
Thank you so much. It was a lovely session. My name is Dr. Kanwar. I represent Key Healthcare. I have a couple of concerns, and the first concern is, our neighbor countries like Pakistan or Afghanistan, they're not getting visas on medical grounds. We have many transplant patients, and unfortunately, we refer those people to other countries. Can we do something for them? Because we always, our Honorable Prime Minister always say, the whole world is one family. I know we would not have a good relation with our neighbor countries, but on medical grounds, if we can, do something for them to save someone's lives. Thank you so much.
I think, I'll take this. Thank you for the question. And yes, one earth, one health, one family is something that we really want to epitomize. At the same time, I think security concerns of the nation are also equally important. While there may be questions, cases of visa delays, etc., at the same time, we also have cases of successful people who have come over, got their visas, gotten their treatment and gone. I think these are certain realities that probably we'll have to live it, but I think as we go on, as the trust deficit decreases, as the processes become more simpler, this will only become easier for people from our neighboring countries to travel. In fact, in medical value travel, close to 80% of the people who come to India to get treated are from Bangladesh. So they are already a dominant, group that come to get treatment in our country. So I think it's a balance between how you go about opening your market for your neighbors, where there are certain concerns at the national security level. But otherwise, I think the whole objective is to make it simpler for people to come in and take training. And I think the MVT portal, I think, will even make it more simpler, because you can actually trace the person right from the very beginning where there is an intent to travel to India for a particular treatment. Whereas earlier it used to happen through agents, and the information there was a lot of information asymmetry. The portal should make it more clearer.
So, in fact, I keep in touch with the Ministry of External Affairs as well as Ministry of Home Affairs. They've given me the link, and my patient put all the reports there, and we wrote many mails to them. Nothing is happening. No. Even, I'm not talking about patient, even the doctors, who would like to come here and, to join a workshop like the robotic surgery or something like, even they're not also getting visas, sir. Doctors I'm talking about, sir, right, from Afghanistan.
Right.
He's a renowned doctor, sir. Thank you.
Right. So I think with the advent of the MVT portal, quite a few of these issues should get addressed. Thank you. I think is there any other question? I think we're done. So may I request you to kindly give your closing remarks before we close the session, sir?
Thank you very much for the audience for their questions, and the panelists for their thought-provoking comments. In fact, I would say that under the G20 Vasudhaiva Kutumbakam, one Earth, one world, I would say that the whole world is at the cusp of a transformational change. And that change was expedited by the Black Swan event, and which has allowed us to view how the life is so transitory and what all we can do while we are alive. And that brings a certain amount of clarity which earlier was not available. And it also allowed us to see how we can move the world, collaborate further, develop our indigenous capacities, and help others. So I would say that India, in terms of health service delivery, I think we go through a great amount of dilemma, We are a huge country ourselves, and we need to do so much to bring healthcare at every household, decrease the out-of-pocket expenditure, which Kiran and his team are working on that I would say, quite valiantly and quite bravely. It's a very difficult task. Imagine bringing the free healthcare to poor people in our country through a system. So, a lot of things which are happening in our country, and there is so much more to be done. And the solution which is coming out is that that we need to get out of our comfort areas and think innovatively. And the innovation would mean working crossing the boundaries and crossing this room and going to the other room and shake hands and let's collaborate. That is the kind of thing which you require. Insofar as skilling is concerned, we have always been stymied by the thick walls which the health and allied professional healthcare has been there, and I'm sure that under the Niti Aayog's influence and the government we will work together to bring certain more flexibility into the system so that without compromising the quality aspects, we increase the delivery part through skilling so that the load on our reliance on doctors and nurses and professional healthcare is to that extent lessened by increasing the supply of the healthcare professionals, allied healthcare. And as Dr. Panigiri had listed out, whether it is the dialysian, phlebotomologist, X-ray technician, or you name the kind of techniques which are coming, which requires felicity with working with the instruments, knowing the basic things, taking the correct measurement, getting the report, using telemedicines, as my friend was talking about Afghanistan, maybe we can use the telemedicine as well. When you're saying Francophone, Kiran, we can certainly, if we get the demand, we'll do that demand analysis. And if necessary, we'll have French classes for our nurses and allied healthcare if they want to go to those countries to work. So I see that there is a lot of changes which are being brought about, whether we like it or not. And these changes are for better, so that we'll be able to work together to improve the health service delivery. Skilling is one of the major elements. It's not that I am the Secretary of Skilling Development, so that's why I'm telling this. Whether it is a healthcare, whether it is a construction, whether it is the green hydrogen, whether it is as simple as having the water supply to every households or sanitation, everywhere the skilling is one of the very, very important inputs. And I'm happy to state that under the present government, under the leadership of Honorable Prime Minister, and there is a lot of emphasis on the skilling side. That is one of the reasons why I'm also here, because healthcare is one of the biggest employer providers. And as Mr. Raina was pointed out, when we did the analysis of the workers required in other countries, we found out that the healthcare dominates the most. And demographics is the reason. And our country, our people are also aging. We are in such a large number. So irrespective of whichever the country and denomination you talk about, there is going to be an increasing demand for people who are skilled and qualified to take care of our healthcare needs. And that is the area where we need to work together. And I'm very happy, Kiran, that you handled the questions so well, and the panelists for giving a very clear-cut replies, and of course you, madam, and the audience also for listening to our conversation, even though it is getting late for your lunch. So I would say once again to the delegates who have come from outside India, our warm welcome to you. Please make use of our hospitality. Come again, and let's see that whether we can work together to make the world one planet, one world. Thank you so much.
Thank you so much, sir.
Mic check. Thank you. Thank you so much to all the gentlemen on stage, panelists, and the audience present over here. I think there couldn't be a better closing than what Sir did over here. And like he mentioned about the hospitality as well, we will be immensely happy to have you over here and join us for some delicious lunch as well, and see that how delicious the food of the country is. Also, I believe that the session had a mission to explore a lot of intricacies of establishing a comprehensive healthcare system to achieve universal health coverage. And with the discussions over here, I hope we were able to take at least one step towards that. Thank you so much once again to all the esteemed panelists, moderator, and our chair. Can we have one huge round of applause for everybody over here? Thank you. And before we break for the lunch, we shall gather once again at 2 o'clock in the Convention Hall 3 for a panel discussion with the G20 member countries and the invited delegates and speakers. Thank you. Thank you once again.